How does health insurance lack billing transparency hurt you? Imagine going to the doctor, expecting a clear bill, but ending up with a surprise charge that you never saw coming. That's what happens when health insurance billing isn't transparent. It can cause real problems for many people. When prices for medical services are not easy to understand or compare, it becomes hard to know what you will owe. This lack of clarity can lead to bills that are much higher than expected, putting a strain on your finances. In the United States, health insurance coverage varies a lot depending on your socioeconomic status and where you live. Most people get insurance through their employer, but even then, the billing process can be confusing. Federal rules like the transparency in coverage law requiring insurers and hospitals to share negotiated rates, but the data is often complicated or incomplete. That makes it tough for you to compare prices between providers or plans. Without clear information, you might choose a plan that seems affordable but ends up costing you more because of hidden charges. When billing isn't transparent, it can make budgeting for healthcare very difficult. If you don't know what your maximum out-of-pocket costs are, you might face bills that are thousands of dollars higher than you expected. This is especially true for people with lower incomes or limited health literacy, who may not understand the details of their coverage. They might avoid needed care out of fear of high costs or end up in debt from surprise bills. Lack of transparency also hurts competition among providers and insurers. When prices are hidden, providers don't have to compete on cost, which keeps prices high overall. This makes healthcare less affordable for everyone. It also creates disparities, as some groups may not have the resources or knowledge to navigate billing complexities. They might skip necessary treatments or face financial hardship because they can't understand or access the information they need. Efforts are underway to improve transparency, like hospitals publishing standard charges and insurers disclosing negotiated rates. But these efforts face challenges because the data can be complex and inconsistent. Vulnerable populations, especially those relying on public programs or employer-sponsored insurance, often lack the tools or skills to interpret billing information. This leaves them at a disadvantage. In the end, when health insurance billing isn't clear, it can lead to unpredictable costs, limit your ability to choose affordable care, and deepen existing health and financial inequalities. Knowing what to expect from your bills helps you make smarter decisions and avoid surprises that can hurt your financial health.